The Resource Center for Human Rights and Civic Education, CHRICED, has raised official issues during a public hearing on the 2025 budget at the Kano State House of Assembly. CHRICED is urging lawmakers to prioritize maternal and child health care, as well as greater transparency and accountability in constituency project delivery. Speaking at the public hearing, CHRICED commended the Kano State Assembly for its commitment to addressing the needs of the people. The organization, however, emphasized the importance of implementing the Kano State Free Maternal and Child Healthcare Law of 2023. The law, which guarantees free healthcare services for women and children, has yet to be fully operational. CHRICED says its swift implementation will not only save lives, but also solidify Kano's reputation for progressive governance. In addition to healthcare, CHRICED highlighted the need for greater transparency in the execution of constituency projects. The group called for a legal framework to guide project selection and implementation, ensuring that citizen needs are properly addressed. CHRICED also urged the Assembly to strengthen oversight mechanisms for all government programs, stressing that such measures are vital in ensuring that government policies and programs achieve their intended objectives.
Finally, CHRICED emphasized the urgent necessity of establishing a robust oversight monitoring mechanism to ensure that government policies and programs achieve their intended objectives without effective oversight and citizen participation. Even substantial budget allocation may fail to produce meaningful results.
Through its grassroots mobilization efforts, CHRICED mobilized community delegates to actively participate in Kano State 2025 budget process. These representatives presented their priorities directly to lawmakers, advocating for equitable and people-centered resource allocation.
On the education sector, establishment of College of Education in Kafumayaki, provision of additional classrooms at government day secondary school Kafumayaki. On the health sector, provision of accident and emergency units at Kafumayaki Cottage Hospital, and then construction of skills acquisition centers in Kafumayaki.
In Kano State, as in many parts of the country, access to justice remains a significant challenge for many of our citizens. Our justice system, which is meant to be the bedrock of fairness, is currently constrained by a number of factors, including underfunding, outdated infrastructure, and an overwhelming backlog of cases. This challenge often leaves our people without timely recourse and undermine their faith in the system.
The development of 3 markets. First one is the Limogado local government central market. The second one is Tambata local government central market, and the third one is the Jobuza market, which is very close to Kano metropolitan. These markets are of economic importance to the societies, and they are being, if you consider their location, they are very much close to the railroads, which is all their highways. And each market day, there are some issues of high traffic and risk. So we look into this. We request the Kano State National State Assembly to consider upgrading the markets by providing them with facilities such as parking spaces, and even, if possible, shifting the market away from the railroads.
As Kano State lawmakers deliberate on the budget, CHRICED's recommendations highlight the pressing need for inclusive governance and impactful reforms. All eyes are now on the Assembly to see how these concerns will be addressed.
Kano State 2025 budget. CHRICED advocate for. CHRICED advocate for. Citizens. Participation. Selection. Learning. Execution.
I am Anyana Princess, reporting for CHRICED TV and Radio.